For the passive movements, we start with the sterno-clavicular joint. We test interior rotation and posterior rotation. Then distraction and compression. Then we test the acromio-clavicular joint with posterior rotation and anterior rotation. We can also test this joint with a bigger lever using the arms with internal and external rotation. The same applies with the acromio-clavicular joint. Then we test the scapulothoracic joint. We do external rotation and internal rotation. Then we do protraction and retraction. Then we test the anterior rotation with the inferior border of the scapula and the posterior rotation. And finally, we test the elevation and the depression of the scapula. An interesting test is to listen the scapula by putting the hands like this on the scapula and asking the patient to breathe in deeply. We observe and feel the symmetry or the asymmetry of the scapula during the movement. For the glenohumeral joint, we test posterior and external glides and interior and internal glide. Then we test inferior glide and superior glide. Finally, we test internal or medial rotation and external or lateral rotation. We test the quality of movement. Another possibility to test the glenohumeral joint is to grasp the arm like this. We test the same movement: posterior, interior, inferior, superior, external rotation, internal rotation. We can also test like this the decompression.